welcome to Pick Dr. Osborne's Brain. Hope you're having a fantastic day. We're going to be talking about zinc. So if you've got questions regarding zinc specifically, I'm going to take those questions first. If you missed our course on zinc on Tuesday evening, I highly encourage you to go back and check that out. It's packed full of about an hour and a half of information, everything you need to know about zinc, how to take it, how much to take, what it helps, what deficiency signs and symptoms look like, how to do proper lab testing, and everything else to fill in the gaps of, what you need to know for this vital, important key mineral. So let's dive into your questions. Looks like Melinda's number one here is zinc the most likely deficiency related to insulin resistance, blood glucose elevation, and hemoglobin A1C elevations when sick with a virus like COVID-19 or flu? No. No and yes. So let's kind of map that out. So I think the question is, can zinc deficiency during an acute viral infection contribute to elevations in blood sugar? Well, if you've got viral infection, one of the things that's going to happen is you're going to get an influx of antibodies and inflammatory chemicals, and that's going to spike basically, we'll simplify this, inflammation in your body, right? So when you got a cold or flu, you get a spike of inflammation. That inflammation generally leads to cortisol output from your adrenal glands. So your cortisol spikes. And then cortisol will traverse to your liver, and it will tell your liver to dump extra glucose into your bloodstream so that you have access to quick energy to make enough energy to help your body fight. And so this would be more of a reason why during a cold or a flu or an infection that we would have an elevation in blood glucose. Now, on the second side with viral infection, what are we needing the zinc for? Zinc and zinc finger proteins help to combat infection, and so you'll be burning through more zinc. And of course, as you burn through more zinc, this is one of the reasons why during or post-infection we get people that lose their taste or their smell. This was especially true during COVID because you're burning through your zinc to try to fight the infection. But one of zinc's other functions is that zinc is think of insulin as this long chain of pearls connected together. And in the center of this long chain of pearls, zinc holds the insulin together. It's the centerpiece, so to speak, of insulin. And if your zinc is dropping, your zinc is low, now your insulin becomes less effective. So the functionality of your insulin attaching to your insulin receptors becomes diminished. And now you can also have elevations in glucose as a secondary consequence of that. But if you're asking me, Melinda, what the primary reason is for blood sugar elevation with colds and flus, it's actually up here. It has to do with the inflammation in the cortisol. Good question. Loss of taste and smell from zinc deficiency common? Yep, I just mentioned that. Is quercetin always good to take with zinc? I'm taking 150 milligrams of zinc. It allows me to eat sulfur-containing food without an allergic reaction. So you might also consider molybdenum. Zinc and molybdenum can have some overlap, but molybdenum is primary mineral for sulfur metabolism. So if you haven't already checked out molybdenum, you might want to maybe go back and watch my crash course on it. But the question is, should you take quercetin with zinc? And if you're at 150 milligrams of zinc, the answer is, yeah, you take quercetin with it. And I would recommend in this case, if you're really trying to drive that zinc in, take about 1,000 milligrams of quercetin in divided doses, split doses 3 times a day. So if you space those doses out over a 4 to 5 hour period, what you're going to do is you're going to elevate the level of quercetins and ionophore. So it opens up the little channels on the surface of cells that helps drive zinc into the cell, so where it can get in there and do its work. So definitely something to consider if you're really trying to enhance your zinc supplementation. Can removing the thyroid gland cause dementia? I mean, theoretically, yes. I don't know that there've been any large-scale studies on it, Dennis. But I mean, generally, I would say removing the thyroid gland, you're going to be on thyroid hormone for the rest of your life. And, you know, if you've got one of those doctors who's not monitoring your levels and really getting it right or helping you get it right, then you could be either over medicated, meaning the thyroid medication you're taking to supplant or replace the lack of a thyroid gland itself. So this is, you know, usually thyroxine or T4, or the drug commonly used here is Synthroid. And we know that actually taking these medications can increase the risk for dementia and bone loss and other health problems. So a lot of times what I see in my practice is people coming in and they've got hypothyroidism. Some of them have no thyroids and some of them still have their thyroid, but regardless of whether they do or they don't, many of them are being over-medicated. And one of the reasons I think this happens a lot is a lot of doctors, they will give thyroid medication not based on laboratory objective measurements as much as they will based on symptoms. So if you go into your doctor and you say, I'm tired and my hair's falling out and maybe you're gaining weight, these are kind of some of the common symptoms that can happen with thyroid deficiency, thyroid hormone deficiency. So some doctors are like, well, I don't care what your labs say. You have the symptoms. Let's go ahead and increase your medication dose. And that's what they do. And then these patients sometimes end up in my office, and then we start measuring things like their TSH, and what we find is their TSH is under 0.5, 0.5, which basically means they're being over-medicated with too much thyroid hormone. And again, that's where you run into those risks. I mean, the flip side to this is being under-medicated, where you're not getting enough, and in which case, you know, these things can happen as well. But generally, if you really want a good assessment of thyroid function, you know, your doctor, most doctors will stop here. This is all they're going to measure, TSH, which isn't thyroid hormone. TSH is thyroid stimulating hormone. It's made in the pituitary gland in your brain. But you shouldn't stop here. This is one you should order, or ask for, but you should also ask your doctor to get T4 and T3. And there's two versions of T4 and T3. There's total, and then there's also the free version, which is honestly probably one of the more important ones to look at. And so a lot of times, if the doctor only measures this, and they're using that as a decision to adjust your medication, but maybe your T4 is just way too high and your T3 is way too low, and they're missing that, right? And this is important because I know we're talking about zinc today, but one of the things that converts T4 into T3 is selenium. And so if you've got high T4 and low T3, you might have a selenium deficiency. Iron helps with that too, so you might also have an iron deficiency. And if the doctor never measures that differential, then you just miss the data, and you're just basing everything off of this one marker here. Now, there's other markers too, like reverse T3, and depending on whether or not if you still have a thyroid, you know, thyroid antibodies, and there's different kinds of antibodies that can be measured, like, you know, TPO and antithyroid globulin. Those all that stuff should be measured, along with nutrients associated with thyroid hormone dysfunction. Iodine, selenium, zinc plays a role in thyroid metabolism, omega-3s, vitamin D, vitamin C, vitamin B2. It's a pretty long list. It's about 20 or some odd nutrients that regulate thyroid hormone production and function. And I know that's not exactly the question you asked, Dennis, but I thought I'd give you a little bit more to chew on. And I have a crash course on the nutritional thyroid parameters, and we'll put a link up for you to go back and maybe look at that crash course. Let's see here. Linda says, zinc deficiency causes white spots on the nails. What would cause them to peel, not split? If you got peeling nails, like if they're peeling back, that most commonly is selenium. Very, very common. So I would be looking at selenium. I'd also be looking at, are you eating enough protein? Because lack of protein can also very commonly cause nails to start peeling back. So Linda, get your doctor to order your selenium levels, and then kind of monitor your protein. A lot of people undereat protein because of all the politics around nutrition. It's unfortunate, but At any rate, protein's essential for nail growth and splitting nails and peeling nails and slow nail growth and hair loss, and frequent infections are all symptoms, very common symptoms of protein deficiency. Let's see. Okay, I answered that one. Hi, Dr. Osborne. Is it possible to experience the start of cold cough symptoms only for it to go away the very next day? Yeah. As a matter of fact, I mean, if you got a strong functioning immune system and your body can do its job really, really well, you know, you can stave off an infection, you know, if you're firing on all cylinders really well. So one of the things I like to have people do at the first sign of any kind of cold or flu, you know, sore throat, achiness, generalized muscle tightness or headaches are common prodromes to colds and flus. Nausea can be a lot of nasal congestion, among other things. But at the first sign of a cold or flu, you know, one of the things I like to have people do is vitamin C flush, which is just high dose vitamin C over a couple hour period of time to just saturate your system. I like to use high dose vitamin D, 150,000 units for an adult. That's IU, and that's per day. And generally that's for 3 days. And then other things like zinc, and anywhere from 50 to 100 milligrams. And quercetin, 2,000 to 3,000 milligrams. Like these are staples. So like if you've been derailed a number of times by colds and flus and really it affects you, and you're sitting right here at that first sign and you know it's going to knock you out for a couple of weeks, hammer these things. Hammer these things. Actually, I have a cold and flu protocol you can check out at Gluten-Free Society. Any of you that are new to the show, go check it out. We'll put a link up for it. But now look, if you're healthy and I even do these things, just so you guys know, and I would consider myself to be healthy for the most part. But you know, you don't necessarily have to do these things. But if you're healthy, it doesn't hurt. But you can also overcome it on your own. I mean, your body can beat a cold or a flu. I think one of the myths in medicine, or one of the flaws perpetuated in medicine, is that the human body is weak and requires medication to be okay, to be healthy. And that, you know, that's nonsense. And nutrition can support the body, like nutrients. These are nutrients the body requires in order to function normally. And so sometimes what happens when you're coming down with a cold or a flu, you just need more of these nutrients to be able to dispatch the virus or the bacteria or whatever it might be more expediently. But, you know, people can overcome them without extra support. That happens all the time as well. I need tips and tricks to going gluten-free. Shalene, have you taken our master class? I have an entire 14-hour master class called Glutenology, and it's all about how to go gluten-free the right way. And I know it, you know, I like to think of going gluten-free as a learning curve. It's like a 12-week learning curve. And so if you're new to it and you're used to kind of more of a standard American diet, it is hard. I remember, you know, 20 plus years ago when I went gluten-free and my family went gluten-free, it wasn't like, you know, one day we were gluten eating and the next day we were 100% perfect in our diet. And so there's a learning curve that comes along with that. And if you're struggling with it, definitely check out my master class. I think it'll be invaluable for you. What was the nutrient that's supposed to help people take the edge off of addiction for a friend whose wife is addicted to cocaine? Well, it depends on the drug, but I mean, as a general rule of thumb, you know, 2 key nutrients I would have everyone consider if they're trying to kick an addictive habit is vitamin B3, or otherwise known as niacin. And generally that's 300 to 500 milligrams a day. And then vitamin C. And the vitamin C is to bowel tolerance. So the way we figure out vitamin C bowel tolerance is we do what's called a flush, which is 2 teaspoons, which equates to 6 grams of vitamin C. every 15 minutes in water, a couple ounces of water, 2 to 3 ounces, until you have diarrhea, to bowel liquidity. So diarrhea, this is what we call a flushing dose. Now, whatever that dose was that got you here, you would multiply it by 75%, 0.75, and then that would be your bowel tolerance dose. So if, let's say, just make it easy math, let's say it took you 10 grams of vitamin C to do a flush, then you would take 75% of 10 grams, which is 7.5 grams, and that's what you would take in split doses over the course of the day for the next several weeks or longer. There's no real danger in taking vitamin C long term. It's a water soluble. It flushes out of the system really quickly. But vitamin C and niacin are the two that can really help with the neurotransmitters of addiction. They're there to support those neurotransmitters of addiction. Let's see, Deb is asking, so how much should one take? And if one doesn't have a gallbladder, what should they take? More zinc or less zinc? Is there a missing part to that question, maybe?
No, she continues after, but I don't know.
If you're saying how much zinc should a person take, depends. There's a range, Deb. So 25 to 100 milligrams per day is really safe. This is a super safe range to consider. I mean, some people go more. I'll take people oftentimes as high as 200 sometimes, just clinically, if we really need it to be therapeutic. But this is a super safe and effective range. Now, if you don't have a gallbladder, missing gallbladder is not so much going to affect your zinc. Zinc is a water-soluble mineral for the most part. The biggest thing you need to make sure you have functioning is acid. You need to make sure your stomach acid is healthy. Your production of stomach acid is healthy, because you need the acid to absorb the zinc. And so if you're on antacids, Tums, Rolaids, PPIs, and the like, you're basically blocking that acid, and therefore you're not going to absorb the zinc as efficiently as you otherwise would if you had adequate acid. And so, if you don't have a problem with acid, great, take the zinc. Don't need to worry about taking it necessarily with something else to enhance that absorption. If you have a history of low stomach acid, then you might consider, well, we have some products. One of them is something called Ultra Acid, and it's a mixture of betaine hydrochloride and some other things that will help to support your absorption of minerals and other acid-requiring nutrients like vitamin B12. But if you're missing a gallbladder, really, if your doctors haven't told you this already, they should have told you this. You're at lifelong risk for fat-soluble and fat malabsorption, fat-soluble vitamins. So that's A, D, E, K, and omega-3. And other omegas, and just fat in general, like this, you have a lifetime risk of malabsorption of those nutrients. And so if you weren't aware, you should be, in my opinion, you should be using some kind of bile acid supplementation. We do have something called Lipogest that is designed mainly nutritional support for people who've had their gallbladder removed. So if that's your situation, you might consider that as something to help support your digestion of fat-soluble vitamins, but not so much will it affect zinc. Every time I play pickleball, after playing 2 weeks, my elbow starts hurting. Pickle elbow. I haven't heard that one. Tennis elbow, I've heard, yeah, for sure. Whatever you want to call it, and it never fails. You got a strength problem, Deb. I would say you really need to probably work with a good doc who understands rehabilitation. Some therapies that can help tennis elbow or pickleball elbow, if you want to call it that. Laser therapy, red laser therapies, cold laser therapies, ultrasound might also be helpful. But at the end of the day, you've got some weakness and maybe some nutritional deficits that are increasing the risk of that injury being repetitive for you. And so you need to get get that part figured out. One of the things that might be super helpful is just testing your vitamin and mineral deficiency levels. If you haven't already used a test like our INA, can we link up to INA? INA stands for Intracellular Nutrition Analysis, and it's a lab test that will help you to discern vitamin and mineral deficiencies so that you know specifically what you need to target in terms of nutritional support. I had 3 different tests of zinc: plasma, blood, and intracellular here in Europe. I guess the numbers are different. Intracellular was 12.8, which can up to 13.6. Most plasma was 6.3. I'm not seeing the question in that. Maybe I missed. Oh, there it is, 6.5 size. I guess I'm doing okay with zinc. So you didn't have an intracellular test. You had, you might have had an intracellular test, but it wasn't an outcomes test. So let me define the difference, because there's zinc plasma that can be measured, which is just measuring quantitatively how much zinc floats in your bloodstream. And then there's generally what's called an RBC zinc, which is a form of intracellular, meaning it's measuring quantitatively. So it's a quantitative measurement inside your red blood cells. And then some labs will run what's called a white blood cell zinc intracellularly, and it's also quantitative only in the white blood cell. Quantitative meaning they're measuring quantitatively how much is there. Quantitative tests are fine, but the problem with quantitative tests is, how did they determine how much zinc should be in a red blood cell and how much zinc should be in a white blood cell? They did that through analysis of GenPop, right? General population. So they took a bunch of people, thousands of people, drew their blood and said, okay, I have all these people that we've averaged how much red blood cell zinc there typically is and how much white blood cell zinc there typically is. And they did what's called a bell curve, a standard deviation calculation. So they basically, if you're familiar with statistics, what they do is they calculate the mean of all those thousands of samples, which is the average. And then from that average, so I'm going to use easy math. Let's say the average is 10, and they will use statistical methods to create standard deviations above and below that mean. So that's if the mean is 10. So let's say the standard deviation is 2. So then 8 and then 6 on the bottom end, and then 12 and then 14. So basically, if you fell within 6 and 14, you would be considered normal range. That's how quantitative testing is formed. It's through creating bell curves around sample populations. Now, there's a problem with that because we take samples of the different people in the population. We're including 300-pound men. We're including 100-pound women. And some are 90 pounds, right? And so obviously we wouldn't expect a 90-pound person to have the same quantity as maybe a 300-pounder, et cetera. So and then there's sex differences, and then there's race differences, and then there's 1,000 variables about a person's nutrition. Do they exercise? Do they not exercise? What's the status of their gut health? Like, these are things when we're drawing up quantitative analysis of general population that doctors aren't asking. They're not taking these people that they're drawing blood from and doing a completely entire full workup analysis to discern all those different variables. So you just get lumped in with everyone. When you get a quantitative analysis type of lab, you just get lumped in with a bunch of people who may or may not be healthy. Technology for it versus just quantitative. I mean, look at how many people go to the doctor today and their serum lab values are normal, or even their intracellular values are normal quantitatively. But when you start looking at functional outcome, we start to see deterioration in function. It's just a more accurate way and a more outcome-oriented way to get better data to help a person in the right direction.
Before you continue, did you mute your mic? Your mic's not working.
Oh. Time out. Yeah, it looks like
just turned off.
I might have just.
Okay, let's just see if it hits screen again.
Sorry, folks.
Stand by.
We good?
Mm-hmm.
Sorry, we had a mic go out. All right. Did we get all that? Or was I talking to myself?
About a minute before you finish.
Okay. Sorry about that, folks. Maybe we can scrap the audio and patch that back up for you. What's your opinion of EBU for removing mycotoxins? I think it works quite well. It's expensive. If you've got the bank account and you can afford it, it's not a bad idea for that as a therapy if you're trying to really get mycotoxins out of you. I'm allergic to fish protein. What's the best iodine to take? I have Hashimoto's. I mean, you could take any iodine. The iodine doesn't contain fish protein. So, I mean, unless you're taking a supplement specifically derived from fish, I wouldn't worry about it. I mean, we have a product called Ultra Iodine that you could use if and it's safe for, people that have fish allergy. Is zinc L-carnosine good? If you're trying to correct zinc deficiency, it's not the one that I would choose. Zinc L-carnosine is more of a specific nutrient that really aids in gut repair and gut healing. Not to say that other zinc can't, but zinc picolinate, zinc citrate, zinc gluconate, any of the good chelates of zinc, I wouldn't use a zinc oxide for sure, are pretty effective. Thoughts on liquid zinc sulfate? Wouldn't be my first choice either. A lot of people have problems metabolizing sulfur. So for that reason, I wouldn't pick that as a first line. Zinc spray on the skin, good or bad? Great as an antiseptic for the skin, but you're not probably going to get tremendous absorption from the zinc spray on the skin. Orally would be my recommendation, taking it orally. How can I know if my body can't absorb the nutrients from food? Does it have to do with cell danger response? So it's an odd question. It's not an insult, but it's just, I want to make sure I understand what you mean by your body not being able to absorb the nutrients from food. Are you talking about digest the nutrients from food or absorb? And is that maybe a typo? I'm going to assume you mean digest and absorb. And how would you know whether or not your body can or can't? Well, there's several things that you would want to look at. And one would be markers. If you're trying to be objective, markers of GI inflammation. Let me put the GI here. So example of that might be something like lactoferrin or lysozyme. These things can be measured. But if you've got inflammation in your GI tract, you're going to have digestion and absorption is going to be affected for sure. Outside of some of these general markers like these, you also want to look at liver and pancreatic function, because these organs are accessory organs to digestion, and the liver, produces bile that helps you absorb fat and fat-soluble nutrients, and then the pancreas produces digestive enzymes that help you to break down carbs, fats, and protein. And so if you've got pancreatic insufficiency or, fatty liver, early stage fatty liver, these are all things that are going to impact your digestion. And then gut inflammation is going to affect it as well, or problems within the gut itself. And then of course, there's also a number of other elements that could play into this. But I would start with those three areas, basically objectively measuring the functionality of the GI tract and whether there's inflammation, measuring the functionality of the gallbladder and the liver, as well as the pancreas. And that's going to give you at least some good direction to go in. Does slippery elm work for constant diarrhea? And what would you recommend? I take the recommended celiac protocol, but still have constant diarrhea. So Bonnie, I would highly recommend that you read No Grain, No Pain, if you haven't already. I wrote this book initially when I was in practice, I'll share a story. I was a young doctor. This was over 20 years ago. And I was seeing a lot of people with gluten issues in my practice. One of my first patients in private practice was a terminal young girl named Ginger. She was 9. And she was given 6 months to live by her rheumatologist over her diagnosis of juvenile rheumatoid arthritis. And basically, this little girl was gluten sensitive. And at first, she was following kind of a regular, what we call a standard gluten-free diet, which is she was avoiding the brow grains. If you know the acronym, that's, barley, rye, oats, and wheat. And she was still sick, and she had 6 months to live. In her case, what saved her life ultimately was, aside from finding out that she was gluten sensitive, was eliminating, in her case, was rice. And she ultimately had to come to the acceptance of that. I had guided her in that direction. It saved her life. But we say no grain, no pain. A lot of people with celiac disease, as a matter of fact, research studies that are 18 months to 5 years long show that approximately 92% of patients that follow that typical brow restriction still have persistent inflammation and still struggle to have full recovery of the villi. And these are celiac patients. These studies were done on celiac patients. And so for me, early in my career, it was this statistic right here that was alarming. When I first came across it in some literature, I said, well, if 92% don't get better, why in the hell aren't we doing something different with this diet? What are we missing? And so I started doing literature dives, and I came across research on rice and corn and other grains driving inflammatory responses in celiac patients. And that's why I wrote this book, No Grain, No Pain. It was to basically save people's lives from antiquated science. It's not that it's bad science. It's not that you shouldn't avoid these things. It's just that avoiding these things isn't enough. 92% don't get better. And so if you are following that traditional gluten-free diet and you haven't read my book, go get a copy. You can check it out at the library if you don't want to buy it. And I don't make anything when people when they buy my book. So do it, and it might save your life, and it might stop that diarrhea. Because I can tell you, you can take a strong probiotic. Like I have, at Gluten-Free Society, if you go to my website, there's a product there called Ultrabiotic Defense. And we use this a lot in people that have persistent chronic diarrhea. And it works really well. I mean, symptomatically, it can help a lot of folks, and has helped a lot of folks in my experience. But at the end of the day, you want to know why you have chronic diarrhea. And that's really the bigger thing to figure out, because slippery elm deficiency is not the reason that you're having chronic diarrhea. So you want to figure out that reason. And there are other reasons too, even beyond grain. That could be other food allergies that you just haven't discovered yet. And so you might consider getting food tested for food reactions and food sensitivities. We'll also see chronic diarrhea in people that have zinc deficiencies. So bringing this conversation back to zinc deficiency can cause diarrhea. Vitamin A deficiency can cause chronic diarrhea. So there are nutrients certainly involved in the regulation of bowel motility and functionality. Let's see. How can I know if my body... Okay, I think I answered that one. Recommended daily dose of zinc. It depends. 25 to 150 milligrams a day for the average person is a pretty good range, depending on your height and weight, etc. Is zinc water soluble? Yes, it is. How much, this is a great question. How much zinc do you need for a family member on several zinc depletion medications? Test it. There's not like a magic dose that works for everyone. But if you are on like a drug, like some of the blood pressure medications inhibit zinc, birth control inhibits zinc, steroids inhibit zinc. If you're on that, you need to at least be on bare minimum 25 milligrams a day. And the thing about zinc is always take it with food, because zinc and iron are two of the more common minerals that can, if you take it on an empty stomach, can cause nausea. So this is a bare minimum for drugs if you're on medicines that block zinc. Now, depending on the person, like I said earlier, you can go up to 150 milligrams a day. But ultimately, what I like to do is test. And ultimately, what I really like to do is help people find a way to not need their medicine anymore. Because if you've got, if you're taking a particular medication, why? What do you need it for? Medicines don't solve disease; they manage it. And if you are in the process of managing a disease with your doctor, that's great for the short term. But what about the long term? You want the drug to have control of your life for the rest of your life, and is there another way to resolve the problem? Without tricking your body into biochemical magic, because that's, in my opinion, that's really what most pharmaceuticals are. It's not to say they don't have a place, but to me, it's funny how many people rip on alternative medicine and call it quackery. But to me, I mean, alternative medicine should be called primary medicine, honestly, because if you're not addressing vitamins and minerals and nutrients and lifestyle and diet first, you're crazy. I mean, go join the crazy camp. I have no room in my heart for people who don't want to understand common sense and logic. You can't overcome a bad diet, and you can't overcome horrible behaviors with illness through medicine. You can only manage it for the rest of your life and spend thousands, if not tens of thousands of dollars on your health care. And then when the medicines quit working, you end up in a much more dire strait, because every drug comes at a cost. Every drug comes with the process of causing malnutrition. A lot of you are asking if I'm really here today, and I am. I've been out of town the last few weeks. We've been doing a lot of traveling this past 2 months. Traveled over 15,000 miles doing interviews for the Mold documentary. I've been to New York. I've been to Phoenix. I've been to Italy. And I went to Italy to visit my dad, who had fractured his hip and had surgery, and wanted to make sure he was okay. And so, yep, I'm back now. So I appreciate those of you who have been paying close attention. Does too much zinc deplete another mineral or vitamin? Too much zinc can interfere with copper metabolism. It's not real common. The reason I know this is because, I mean, it's theoretical that too much zinc inhibits copper. But I've been doing testing. I've probably done over 50,000 tests in my career, probably more. That's just a rough estimation. But theoretically, high levels of zinc can compete with copper, and so potentially can reduce copper. There are some researchers that believe that when you're taking zinc, you should take zinc and copper together. And the ratio, some argue it's 10 to 1, 10 zinc to 1 copper. Some argue it's more like 7.5 to 1. I have found that it's not necessary. What I generally do is I have people, at least in my practice, they're on a multivitamin that does contain both zinc and copper. But if I want to give them extra zinc, I'm just going to give them the extra zinc based on their lab tests. Because when I test people, I test them for both zinc and copper deficiency. And if they don't have copper deficiency, I'm not worried about creating a copper deficiency by correcting a zinc deficiency. And I have just not seen that be a true pattern of what actually happens clinically as an outcome. But to answer your question, yes, in theory, zinc can potentially deplete copper. And so if you're on your own, not doing any testing, it's sound advice to make sure that you're also getting enough copper in your diet, or even potentially through supplementation. If zinc gives me anxiety and headaches, what else can be missing? I would say check the zinc that you're using. A lot of zinc products contain filler. And if we look at some of these fillers, one of the ones that I hate the most seeing in supplement brands is rice bran as powders as a filler. I see this a lot, even in products that claim to be gluten-free. Big mistake. We see people reacting to rice bran all the time in their supplements. Plus, the rice that's generally used as filler in supplements, a lot of times you get lead or cadmium contamination of some of those products. And so it's bad for that as well. It's bad for more than one reason, but lead, cadmium are good enough to want to avoid it. But oftentimes too, there's other fillers. And so you got to look at some of those other fillers. Are you taking a pure elemental zinc? Or are you taking a product that has a bunch of other stuff in it that maybe you're reacting to the other stuff, and the other stuff is causing headaches? Because it's not real typical for somebody to have a side effect like that, anxiety or headaches when taking zinc. Now, ultimately, you would want to get a full spectrum test done that measures all your vitamins and minerals, because yeah, it's possible you're missing some other things that zinc could have some interplay with. And by taking that zinc, you're triggering a tripwire nutritionally somewhere else down the line where you're not supporting yourself with another nutrient that might be important. So ultimately, you guys have been watching me for any great length of time. You know me, test, don't guess. And because when you guess, it's speculative, and maybe you guess right, maybe you guess wrong, but it's just better to know. It's better to know and be sound in the decision that you're making. Are we back in sound? We're good, Mel? Okay. I'm on itraconazole, 100 milligrams twice a day for mycotoxins. Why are you on itraconazole, Heather, for mycotoxins? That, I mean, you know, maybe your doctor, let's get some clarity around that, because itraconazole is what we call an azole antifungal. And what it does, it doesn't do anything for mycotoxins directly. What it does is it kills mold that's growing in your body. So, you know, classic example would be like if you have a candida overgrowth. You guys have probably heard of Candida. Candida albicans is it's normal inhabitant of the human body, but at high levels becomes pathologic or it becomes disease causing. Candida can produce gliotoxin, which is a type of mycotoxin. But so where I don't have clarity from you is you're taking this to get rid of mycotoxins, but really what this is doing is it's killing any kind of mold inside your body. So confirmation's sake, did you get diagnosed with candida overgrowth, and do you have high levels of gliotoxin? Because if you've got high levels of ochratoxin A or high levels of trichothecene or some other type of mold toxin, taking an azole antifungal is not going to directly impact your mycotoxins at all, unless maybe your doctor diagnosed you with something called mold colonization, which is a possibility. And if you have mold colonization and your doctor's treating you with an azole antifungal to kill that mold, and by killing that mold, you stop the internal production of mycotoxins, perfect. That's the right move. You know, that being said, do you need to be on binders? What are the binders for? The binders predominantly, the things like charcoal and zeolite and clay, binders when it comes to mold, they don't, what you're trying to do with binders is you're trying to attach a binder to a mycotoxin in the GI. Predominantly, this is in the GI tract. This occurs in the GI tract. One of the primary routes of excretion of mycotoxins is through the gut. And so when you take that binder orally, that binder attaches to that mycotoxin so that then you can poop it out. If you don't take a binder, what happens is that mycotoxin that's freed up, it doesn't get bound. So what happens is as your liver over here, excuse my terrible drawing, but your liver produces bile, dumps that bile into your small intestine. That bile has a high affinity for mycotoxin, so it binds to the mycotoxin. And then what happens to bile? The fate of bile is that like 90% of your bile gets reabsorbed in your intestine. So what happens is the bile plus the mycotoxin go back to your liver. They get reabsorbed because your body likes to recycle bile, likes to reuse it. So if the bile has a mycotoxin attached to it, you're just pulling that toxin right back to your liver. And what's the danger of a mycotoxin is that they damage the liver. So the binder is important for stopping this. There's a name for this, by the way. It's called enterohepatic circulation. Entero meaning small intestine, hepatic meaning liver. So what happens is that you get a recycling of that toxin back to the liver through the attachment of that toxin to bile. And that's the binder's job, is to block that from happening so you can poop out that mycotoxin and not keep recycling it back to your liver and creating liver damage. So anyway, I know that wasn't your exact question, but I hope that giving you that context around it gives you some clarity and helps you understand a little bit better about what you've been told and what you're actually doing and why. Which thyroid meds interfere or reduce zinc? All of them, including the natural ones, including the bioidentical ones. What's the best time of day to take zinc? Should it be taken away from other vitamins such as tryptophan before bed? No, the best time of the day to take zinc is the time you remember, but ideally take it with food, because food is going to stimulate your stomach to make acid, and that's going to help with the absorption. So as opposed to taking it on an empty stomach, some of you have iron stomachs and can take whatever you want to and it doesn't bother you, but to enhance the absorption of zinc, we really ideally take it with food. But timing, whether you take it in the morning, at noon, or in the evening, is not really the most important thing to focus on. Yeah, Anna commented there was a comment earlier about EBU and mycotoxins, and Anna commented that it didn't really do much for her. That's true. It does. I've seen where it does wonders for patients, and then I've seen where it doesn't do much for people. So it's, again, with the cost of it, that's the risk that you take. If you're monitoring a person with Hashimoto's and high TSH, would you want them on levothyroxine? It depends, because high TSH, we got high TSH. What is that? For most labs, that means that your TSH is above 4.5. But yeah, you have to remember that. So here we have the thyroid gland. And so this is the thyroid gland. And then the TSH travels to the thyroid gland and it stimulates the thyroid gland to produce T4. And then as T4 is running through your bloodstream, and also T3, but most T3 is made in the periphery from T4, and that's done in the liver, that's done in the muscle. So we just say peripherally, T4 is converted into T3, which T3 is the active thyroid hormone. T4 doesn't work. You have to convert it to T3 for there to be any functionality. So T3 is what actually talks to your DNA and increases your metabolic function. So if somebody has a high TSH, for me, just blindly putting them on a levothyroxine may or may not be the right move, because there's other contexts to that. So for example, you could have a high TSH because your iodine is low. So if you have low iodine, why iodine? Because what is this 4? This 4 is iodine. It represents 4 atoms of iodine. If you're iodine deficient, you don't have enough iodine, what happens is this is a feedback loop. As you have enough T4, it blocks your body's production of TSH. If you have enough T4, you send a feedback loop to your brain and say, hey, we got plenty of T4. Don't worry about making more TSH to stimulate the thyroid gland because we're doing well. If your T4 is low, then that same message goes to your brain and says, hey, make more TSH to tell the thyroid gland to make more T4. If you're iodine deficient, you're not going to be able to make T4 effectively. And that's going to cause you to drive up your TSH. So that's just one example. I mean, we could talk for a couple hours on nutritional relationship with thyroid hormone, but if somebody's got a high TSH, I want to know why. And the reason a person has a high TSH is never because they have a deficiency of a drug called levothyroxine. It's never the reason why. So put the O in the wrong place for those of you who are stricklers. So the drug itself, a deficiency of drugs doesn't cause disease. And so anytime we're talking about a disease like hypothyroidism, the question is, why is that happening? And if you reverse engineer the whys and understand the biochemistry and the nutrition, and a lot of times the medicine itself becomes unnecessary for people. And that's not to say that there aren't indications for levothyroxine and that there aren't people that need to be on it, at least in the short term. But I hope that gives you a little bit more context around it. Let's see. When I take NAC, I wake up and can't sleep. Is that normal? No, you are probably mobilizing toxins when you're taking NAC. A lot of people that when they can't tolerate NAC and it causes secondary or tertiary side effect, like poor sleep, it's because NAC mobilizes toxins out of your fat and out of your other tissues. And so you've probably got a toxic burden, which toxic burden it, remains to be. That's something that you would need to get tested for. But so that most likely is what's happening if you don't tolerate NAC. A lot of people that don't tolerate glutathione or NAC, they have a toxic burden, and that's the reason why. How can I get an appointment with you? Call our office. Can we post that? The phone number? Yeah. And then, or you can just go to, what is the website? originshealthcare.com.
That is correct.
Yeah, originshealthcare.com. I don't even know my own website. For fast metabolizers, a CYP 450, blow through pain and anesthetics, should I be supplementing glutathione to support the detox so not overwhelming the liver as quickly? No, because you're punching it out faster. Your liver's just a rock star, and it's metabolizing that drug out of your system better. Now you could support your liver when you're taking any kind of medication, and that's perfectly fine. But if you're a fast metabolizer, it doesn't necessarily mean you need to take glutathione. Would you please address celiac patients with adverse reactions after a dental procedure, such as increased tooth pain, gum redness, and mouth sores? Yeah, I mean, that's a dental procedure is a surgery. And depending on how invasive or aggressive it was, I mean, there are different kinds of procedures, certainly. But this is just my experience in celiacs. And this is no offense to you or any other celiac patient who hasn't heard or read this before. Most celiacs, as I mentioned before, 92% have persistent inflammation because what they're eating, the gluten-free food they're eating is, it's localized or isolated only to wheat, barley, and rye, sometimes oats. They're still eating typically corn and rice. They're eating all these gluten-free, quote unquote, gluten-free food, processed food, keyword processed, like breads and pastas and cereals. They're eating the gluten-free junk food aisle. You're never going to heal eating gluten-free processed food. And I know that sounds a little harsh, but it's just my experience, in 25 years of practice, is that when we see somebody with celiac disease try to go to the gluten-free aisle and do one-to-one substitutions with their bread and pastas and cereals and other things, they generally have persistent malnutrition because these foods also damage the GI tract, and there's many reasons why. I mean, I have over 1,000 research referenced articles on Gluten-Free Society that you can read about this in its entire body. I've written a book on the topic called No Grain, No Pain, and I've put together multiple long-form, deep dive videos on this particular topic, which you can watch on my, for free on my YouTube channel, or you can go to Glutenology and you can check out our master class. But what happens is these people are staying malnourished. And when they go in to have a trauma, scheduled trauma, that's what surgery is. Any procedure, any surgical procedure, by default, is a scheduled trauma. Now, that's not to say it's not necessary. It's just to simply say that the act of a procedure is a form of trauma because you're drilling in the mouth you're cutting a gum or whatever it is that, again, that dentist is doing. And so what has to happen after you've had that trauma from the surgical procedure is, if you're malnourished, you're not going to heal very well from it. And so you get poor healing. And so you get things like mouth sores and tooth sensitivity. With celiac specifically, if you're still eating this stuff, there are antibodies that are produced as a result that destroy tooth enamel. And so you get hypersensitivity in your teeth. It's just a very common phenomenon. This is why celiacs have more cavities. This is why they have more tooth decay and oral health problems, is that there's an actual autoimmune process against the proteins that produce the enamel around the teeth that protect the teeth. And so if you're still eating those kinds of foods, even if you're wheat, barley, and rye free, that's probably still happening to you, and that's probably why you're still struggling. So I would strongly encourage that you go and look at reading No Grain, No Pain, and seeing where your diet is in conjunction with the diet in the book. And if you're far off, do the diet for 30 days. Come back and talk to us and see, was it helpful for you? I like the feedback. I love it when people come back and praise the work of my decades of experience, and that it helped them in some way. Because that's why I do it. I do it because I want to help people. Our mission here is to help save 100 million lives. And, we take that mission really seriously. Is glutathione helpful for essential tremors? Depends on what's causing the essential tremors. Glutathione is really helpful to detox. And so if your essential tremors are caused by some type of environmental toxicant or food-based toxicant, glutathione might be beneficial in that regard. But you have to figure out why the tremors exist. And this is true of any question. Anytime you guys ask me a question, is this nutrient beneficial for that disease? The answer is always going to be, why do you have that disease? Because maybe the nutrient deficiency is playing into that disease and it's part of it, but maybe it's not. And therefore, if you're taking a bunch of supplements, but not seeing improvements or not seeing that you're getting better, you've got to reverse engineer the illness itself. I'm taking barley grass, spirulina, and milk thistle daily. I'm having an increase in mucus. Is that a herx? No, it's that you're taking barley grass and you're probably reacting to it. 40% of the U.S. population, and I think it's even more than that, but it's at least that. It's a high number. 40% are allergic to grass. And so it doesn't surprise me if you're eating barley grass that you would have increased mucus. Because what is increased mucus? Increased mucus is your body producing a coating to protect you from what you're consuming. And so if you're doing that barley stuff, I see this a lot, you're making that mucus to protect you from it. And there's inside of that mucus, there's antibodies like IgA, which bind to the proteins in the barley grass and neutralize them or help you to neutralize them. So, I would consider if you're skeptical about it being the barley grass, take spirulina by itself, take milk thistle by itself, and see, do you still have that same type of mucus response or not? Let's scroll down. What's the mechanism by which glutathione lowers hemoglobin A1C? A reduction in inflammation, predominantly. Inflammation drives up cortisol, which elevates blood sugar. So anything, a lot of supplements, and these have been studied in humans, but a lot of different supplements, glutathione, berberine, turmeric, a lot of the anti-inflammatory natural compounds lower blood glucose in human trials and in animal trials. And that's because inflammation itself elevates blood glucose. So when you're taking a product that's anti-inflammatory, you're not solving for the problem. You're using green medicine to bring down inflammation. The real problem is what's causing the inflammation. And so if you solve for the inflammation, you don't necessarily need to take a bunch of anti-inflammatory things. Had heartburn and I fixed it. How'd you fix it? But now very bitter taste in the mouth. I would say if you have a bitter taste in your mouth, you didn't fix your heartburn. You may have improved it, but a bitter taste in the mouth is a symptom of heartburn. So it's just a milder symptom. So that, I would, if you want to comment more and give me more context, I might have more for you. So I don't know if I'm saying your name right. C. Beardsley did an INA test and her zinc was insufficient, 140%. 76-year-old with rheumatoid arthritis, post-polio, already taking 90 milligrams of zinc a day in various supplements. I take methotrexate, Humira, Celebrex, pantoprazole, famotidine. God, that's a nightmare. What should you do? You should find a doctor who's willing to help you in other ways than just medicating you into the ground, into the grave. Methotrexate destroys your gut lining. And one of the problems that I see with methotrexate when I'm seeing somebody with rheumatoid or other forms of arthritis that are on methotrexate as their treatment option is these people can never get better because as long as your gut lining is being destroyed by the medication, it's leaking, and leaky gut is a precursor to rheumatoid arthritis. So this is masking the pain while perpetuating the illness. So you become a slave to it. And on top of that, it inhibits folate, and they probably have you on folic acid, which is synthetic folate, which is not good for you. And that's a whole nother conversation, but you're not going to win with this. Now, this isn't me telling you what to do with, this needs to be a deeper conversation with your doctor, but I want to give you context for how to have a conversation. You're also taking several antacids. So like the pantoprazole, the famotidine, those are blocking your stomach acid. So your stomach acid is being neutralized by the medicine you're taking. What did we say earlier about stomach acid? We said it's a requirement for zinc absorption. And here you are taking 90 milligrams of zinc. You're not absorbing it. So your stomach acid production is being decimated. Your GI tract is being destroyed. Your ability to digest and absorb is not going to be good with that combination. And then, if you're also taking Humira and Celebrex, Celebrex reduces zinc, and it reduces folate, and it reduces vitamin C, and vitamin C reduction increases pain, and it can mimic rheumatoid arthritis. I mean, I've seen this clinically, but there's many case reports on vitamin C deficiency scurvy actually causing rheumatoid arthritis. But their doctors don't check their vitamin C, so they never get it. They never understand that. And so then they end up on methotrexate for the rest of their life. I'm surprised to hear you say you're also on Humira. Humira, the biologic, is also just wrecking your immune system. So it's increasing your risk for potential development of cancer. Look, I don't want to scare you, and I don't want to say all those things to frustrate you. But look, if you were my mother or my wife or any woman in my world that I sincerely cared about, I would find a new doctor. That would be what I would do. Let's see here. So somebody's asking about, does vitamin C at night hinder good and deep sleep? No, haven't seen that to be the case. Clinically speaking, I mean, there may be other opinions about it, and that's fine, but I haven't seen that be the case. I would say if it's bothering you, obviously adjust your timing on it, but it's not something I would say is an issue. Tamoxifen since August, horrible bladder pain and pressure. Finally, someone made a connection, stopped tamoxifen. What can she do to detox? I mean, time. is going to detox that medicine out of her. I mean, she can take extra glutathione and she can take extra vitamin C and lipoic acid as well. So those would be things that I would probably consider. Are coconut flour and chickpea flour gluten-free? Yeah, if they're not cross-contaminated, they are technically gluten-free. Which form of niacin for addiction? Niacin or nicotinamide? Niacin, the flushing kind. Is there a nutrient that gets depleted from taking zinc? I think I answered that already, and we talked a little bit about copper. For psoriasis and eczema, should zinc be paired with other nutrients? For psoriasis and eczema, you should be ascertaining why you have psoriasis and eczema. There's many different causes, both nutritionally and environmentally, that you should have investigated, son. And that's what I would encourage you to do. And get out in the sun, because one of the primary fantastic treatments for eczema and psoriasis is UV light, natural sunshine. They'll tell you to stay out of the sun, but UV has immune modulating benefits on the skin, as does infrared therapy, or the infrared rays from the sun. For uveitis, would you recommend eliminating all dairy? For uveitis, as a generalization, Rachel, I would recommend no grain, no pain diet. Go get the book. It's got a phase 1, phase 2, 30-day diet. Stay on it longer than 30 days, because it's going to take longer than 30 days to resolve a uveitis. But uveitis is part of the autoimmune family that it is commonly associated with what's called Reiter's arthritis, Reiter's syndrome, and rheumatoid and the like. And it typically responds extremely well to diet change. So I would do that first. Like if I wasn't working with a doctor and I just want to say, okay, what can I do in my diet? Low hanging fruit that I can start right away to help with this. That would be the place that I would start. And then based on how well that worked, I might look at doing a deeper dive into other things, because autoimmune disease, which is what uveitis is, has 4 primary triggers that your other doctor's never probably going to tell you about. Usually when the topic of autoimmune comes up, here's what most of you get told. We don't know why you have it. This is what most doctors are going to have that conversation with you, is that we don't know what causes it. And then the second paragraph out of their mouth is going to be, but we know how to treat it. And it's with these really powerful immune blocking drugs that give you cancer after 20 years, or that can give you cancer. And this is where, when I was in the VA hospital training in graduate school in rheumatology, this is what I never understood, is that they always would tell us, we don't know what causes it. My attending physician would say, we don't know what causes it. But then he would always say, well, yeah, but we know how to treat it. Like, well, if you don't know what causes it, how do you really know how to treat it? You're managing it. Nobody wants to be managed. Who wants their life to be managed by another person who doesn't have to, where there's no consequences to that person's mistakes for trying to manage another person's life? And so I never understood that. But when I was going through my training, I was given a book called the Primer on Rheumatological Disease. Basically, it's the Bible of autoimmune disease for doctors training to treat it. And when I read the book, because they told me it was a Friday, I remember it very distinctly because it was a Friday. And when you're in graduate school and you're burning the oil at both ends, the weekends are your favorite time, because you have a little bit of reprieve from just the massive amounts of studying you have to do. And so I was looking forward to that weekend, and they handed us this book on a Friday and said, don't come back on Monday unless you've read it cover to cover. And that's why I remember it so well, because it was like, damn, I have to read this whole thing. And so I read it, and I made so many highlights in the book. cover to cover. And what I found when I read it is, and understand this is a book written by like 100 different doctors. They all convened together. Certain doctors wrote certain chapters because their expertise was on certain types of diseases. And so, but the pattern that I kept coming across when I read that book, and the things that I kept highlighting were basically teaching me that we do know what causes autoimmune disease, because each chapter on each disease, there were triggers that these doctors and researchers would talk about with these autoimmune diseases. Like, for example, many of the neurological autoimmune diseases, there was this big theme in the background of pesticide exposure in these people. A lot of these people that developed it were exposed to the different pesticides that were being commonly used. Farmers were more commonly susceptible to these illnesses. Many of these illnesses matched very beautifully post-polio syndrome, which we don't have time to get into all that today. That's a much deeper history. But my point is, okay, pesticide is a trigger, or at least at least there's an association, right? Where we see people that are exposed to more of this have more of this. And I kept running across just these different links and associations with autoimmune disease. And ultimately, when I finished reading the book, I kind of sat down. I'm a big picture guy. I like to think broad. And so I sat down to try to categorize what categories could we put these different triggers in for autoimmunity based on this book that was written by more than 100 other doctors, knowledge, wisdom, and research. And the categories that I succinctly put them in was, number one, first category was food. And we knew this really well because we have celiac disease as a model, and everybody knows that celiac disease is caused by gluten, which is a protein found in grains. But there are other foods that drive autoimmune disease, not just gluten. The second category was chemical exposure. And so this is the example I just gave, which is, the pesticides. So chemical toxins in the environment. Pesticides are very common, but another really common one is mold toxins. So basically chemical exposures, heavy metals, another example. Many heavy metals have been linked to autoimmune diseases, etc. So food and chemicals. And then category number 3 was microbes, meaning that we knew that many autoimmune conditions were triggered by an initial onset of infection. And so, like, a lot of people didn't have an autoimmune disease, they were perfectly healthy, and then they had a cold or a flu or a virus or a bacterial infection, and then bam, the autoimmune disease starts hammering them. So, if we think about this as virus or viral, bacterial, fungal, or parasitic, the 4 primary categories of microbe invasion of human hosts. And then there was a 4th category of trigger, and that was nutritional deficiency. And, classic example is vitamin D deficiency with rheumatological arthritis. Is very well studied and very well researched. So after I sat down and I kind of mapped this out, I went back to my attending physician. I'm like, you keep telling us that there's no known causes for autoimmune disease, but you asked me to read this book and we have all these triggers. And what I would like to do is take just 10 people aside, and I'd like to do some chemical analytics on whether or not they have these as problems. And then if they do, address them. And if we address them, I'd like to measure the outcome and see if they get better. And I was told no. I was told no multiple times. I tried multiple ways to try to finagle that into my attending's heart, mind, whatever you want, but he would have none of it. Ultimately, I ended up leaving the VA, and one of my first patients in private practice I mentioned earlier was a terminal patient with juvenile rheumatoid arthritis, and we saved her life. She's still alive today, and that was over 25 years ago. But it was this saved her life, this right here. And so any of you that have an autoimmune diagnosis, and you've been told, we don't know why you have it, but we do know how to treat it, and here's this medication that you can take for the rest of your life and manage it. And if you don't take this medication, you're going to be in a wheelchair in 2 years or 5 years. They like to use fear. A lot of doctors like to use fear to push treatments that otherwise would be just unamenable. Ask them this, test me for this, test me for this, test me for these things. And if they say no, go find another doctor. That's the best advice I could give anyone with autoimmune disease. I mean, I've seen in my career over 10,000 cases of autoimmune disease, well over that. And many, many cases, thousands and thousands of cases I've seen resolve. That's not to say we know everything, and that's not to say there aren't other unknowns that we're going to discover in the future. But if you have autoimmune disease and you haven't investigated those 4 categorical triggers, you need to find a doctor who understands it and will do that with you. Have you ever seen a Hashimoto's go into full remission? Yeah, absolutely. How long, Lucy, I missed a couple above that. Son, after a longer time taking zinc, you deplete. No, that's commentary. What's the best gentle liver detox for someone with autoimmune Hashimoto's? I mean, gentle is just go to bed on time, eat whole, real food, exercise to your ability to tolerate it, get sunshine every day to your skin's ability to tolerate it without burning, drink clean water and breathe clean air. Your body's detoxing 24/7, Heather. And your liver's always on, your kidneys are always on. So if you take care of them, if you nourish them, they're going to nourish you back by helping you detox. If you've had a historical trouble with detox, just know that and have faith and trust in your body. I mean, other things you can do that are more mild would be just lower doses of nutrients that have detoxification support capacity. So like if you've tried glutathione and it's just too much to handle, then maybe try half the dose or a quarter of the dose. I mean, so there's always ways to tailor a program for detoxification to make it less aggressive for the person who's experiencing just a quantitative change in their quality of life that isn't good. How often is it healthy to do a vitamin C flush per week? Oh, you don't need to do more than 1 per week. I would say do 1. If you're trying to do them kind of somewhat consistently to recalibrate your dosing structure, once a month. Now, I'll have people sometimes do them once a week, but there are specific reasons why I might want that to be the case. But you don't have to do a flush that frequently. For a family member on antacids who is zinc deficient, Melinda, you got a lot of family members. No, I'm just picking on you. And won't stop the Tums. Can they absorb zinc in the mouth? No, I mean you could do sublingual, but it's not as effective. And if they continue to take the Tums, they're going to end up with tremendous amounts of problems. And that's not me saying that. I mean, you can go have them read you can't change the mind of a family member who's not wanting to change their behavior. I mean, ultimately, you just have to, unfortunately, accept that in many cases. Even in my own family, I have that happen. Can the INA test be done if one is out of the U.S.? Yeah, it can be. Reach out to my Gluten-Free Society or glutenology@gmail.com support staff, and they can walk you through it. Can a woman with Hashimoto's do long-term water fasting, 7 to 10 days, safely? I wouldn't do it without supervision. Generally, women with active autoimmunity and struggling in their health are not the best candidates for fasting. And it also, big part of that also depends on what part of their cycle that they're in as well. So many different zinc supplements. Which are the best for absorption? I recommend, I'm partial. I have my own formula. It's called Ultra Zinc. That's what I would recommend if you're looking for a high quality zinc to take. When will food sensitivity tests be available again, please? I just got back, today's really my first day in the office, not seeing patients this week. I just got back late last week, and I'm supposed to have a meeting this week, the end of this week, to discuss that very question. So I'll have more of an answer for you here very shortly. It should be any day now. Can TPO antibodies go down? Shouldn't those antibodies be monitored? Yeah, if you have Hashimoto's, they should be monitored. Most endos are going to tell you never need to test them again. They're just going to give you the diagnosis of Hashimoto's, and they'll never check your levels again. But we see people's antibody levels going down all the time just with simple diet change. So in that case, just a few weeks ago, before I left on my vacation to her levels were well over 1,000. I mean, the reference range stopped. They stopped counting after 1,000. So her levels were just higher than 1,000, right? And we had a follow up and after diet change, and now her levels were under 100. So can they go down? Absolutely, they go down. How soon after showering or after sweating in a sauna for detox would you recommend showering? As soon as you can. Depends on what kind of toxins you've got in you. But showering as soon as you can within reason. I wouldn't, race home if you're going out to a sauna. I wouldn't race home and, speed out of fear. But as quickly as you possibly can. Is ascorbic acid like citric acid as an ingredient in food that is synthetic and bad? No, ascorbic acid doesn't have to be synthetic. And citric acid doesn't have to be synthetic either. There are different ways to produce it. Is red light therapy or steam sauna better for someone with Hashimoto's? What's best for someone with Hashimoto's is determining the 4 families of triggers that are triggering their disease, because red light therapy is a passive therapy. Steam sauna is a passive therapy. When you use passive therapy, you get passive results. And it's not to say that passive therapies can't be beneficial. Red light can be helpful. Steam sauna can be helpful, but you're not going to cure your Hashimoto's with either red light therapy or steam sauna. So you need to figure out why you have it. How can night cortisol be reduced? If you're just trying to get a good night's sleep and you've got high nighttime cortisol, one of the best things to take, we have a couple of things that I can recommend. One, we have a product called Ultra Calm, and it's got different vitamins and different herbs that can help to offset high cortisol. And another one is just taking pure L-theanine, which there's studies showing that it actually does modulate and bring cortisol down. So it's one of the reasons why, a lot of people take it at night before bed as a sleep aid, especially if they're under a tremendous amount of stress. What can I do from the fishy smell, trimethylamine production from taking L-carnitine? Try mixing it with vitamin B2. Vitamin B2 helps to metabolize the TMA. And you probably need to go as high as 100 to 200 milligrams a day, and it'll turn your urine super, super yellow, and don't let that freak you out. When you give zinc and quercetin to correct loss of taste and smell, how often does that work for you? Probably 80–90% of the time. Sometimes there's other reasons taste and smell are lost. Is there any workaround for sun sensitivity from taking B6? Rephrase your question. I'm not sure what you mean. Generally, B6 shouldn't be causing sun sensitivity. And what kind of B6 are you taking? Are you taking P5P or are you taking pyridoxine? Because they're not the same. I found the functional doc with a micronutrient test. They contract to SpectraCell. Should I do it? I mean, I used SpectraCell for a number of years. It was a good test. It's still a pretty good test, but the reason I don't use them anymore is the technology's improved and we have better technology. The other reason, though, I don't use them, and I started to see inconsistencies in some results, and so I did some double blinding or some blinding of test results or of tests on blood, and I was getting inconsistencies back, and it started, and this was shortly after the company sold. A lot of people don't realize it. Anytime you have a great company that does great work, and then it sells to another company, usually the new company coming in cuts corners, doesn't understand the mission, doesn't understand what makes what they just bought so great, or they do understand it, but they don't care about it. And so they diminish it. And that's exactly what happened at that lab in my experience, is a Chinese company bought them out. And from there, it was just downhill. And so we abandoned them, I don't say we abandoned them, they abandoned us, but we left using their services years ago for that reason. I can't imagine their problems have gotten any better, is what I'm trying to tell you, Maggie. Do you think excessive sweating is a problem? My niece is on a medication to decrease sweating. I think this sounds harmful. Yeah, I mean, I don't like medicines to reduce sweating, and excessive sweating isn't a problem pathologically per se, but define excessive sweating. There's different opinions about what that might mean. I'd say the biggest risk with excessive sweating is that a person could dehydrate more readily or is losing electrolytes through their sweat. So that would be a potential for a problem. But sometimes people have excessive sweating due to toxic buildup, and it's just their body's natural response. And if this is a teenager and she's eating the typical American teenage junk food diet, it wouldn't surprise me that if she changed her diet, that she would change her sweating pattern. Diagnosed with high blood pressure, are there ways to reverse it? Yeah, go watch my crash course on blood pressure. It's a big question because there's a lot of reasons why high blood pressure can happen, but there's a lot of vitamins, minerals that play a role in blood pressure regulation you need to learn about in order to get a good answer to that question. But step one, if you use low-hanging fruit, go on a no grain, no pain diet. It's a strong anti-inflammatory diet, and remember that high blood pressure is inflammatory in nature. Are whole food vitamins better than synthetic? Depends, Deborah. I'll give you a classic example where whole food vitamin is not better than synthetic, and that is in the form of vitamin B1 as benfotiamine. It's a far superior, clinically outcomes-oriented nutrient. It works better. You can use natural plant-based or food-based vitamin B1 and get nowhere near the clinical outcomes and neurological problems that you can get with benfotiamine. And I've seen that countless times in people with neurological disorders. So it depends on which one you're talking about. I think there's a lot of people online talking about synthetics as being evil, bad things. I think you have to add more context to the conversation than that. Ideally, I prefer natural biochemically produced supplements versus petrochemically synthesized things as a general rule. But we also have to take into account who's using it, why are they using it, and what is the general outcome that we're trying to achieve. And so I don't think there's a perfect answer to that question. I don't know if that helps you or not, but my experience when people take like whole foods and powderize them and freeze dry them and put them in capsules, and then take that as their vitamin or mineral supplement, it's just my experience that those people who are doing those types of things, when we test them, they're in worse shape than the people who are taking good quality multivitamin formulas or other things. So those food-based supplements, and I think it's just a quantity issue. Those dehydrated powderized foods just don't have the dosing structure that you're going to get from others. Can I explain the zinc flash that happens at conception? I can't. There's some things I can't explain, and that's definitely one of them. I mean, I think we all have theories. I think that has more to do with the spiritual connection of a soul to a biological life form, and zinc playing a role in that. But, that's just my own speculation. In an X-ray, a GI tract looks like it's filled with gas chronically. Anything more likely to cause this? I mean, lots of things. I mean, poor digestion would be one. Whether or not a person has adequate capacity to make digestive enzymes, whether or not what kinds of food that they're eating. There's certain foods that are more gaseous producing. There's certain bacteria that will produce more gas when you eat certain foods. So, I mean, there's a lot of potential reasons as to why that might be the case. What is liposomal vitamin C, and would you recommend this? It's basically it's a vitamin C that's been it's been surrounded by a cage so that it can be better absorbed. I don't like liposomal vitamin C necessarily any better than I like buffered mineralized vitamin C. Just clinically, there's not a difference in what I've seen from one to the next. Liposomals are generally a lot more expensive. And a lot of the liposomal products are corn derivatives. So they're using like a GMO corn base to create that liposylized molecule. And so that's just another reason why I'm not always a fan of just generically somebody using liposomal. A friend went to the ER with severe stomach pains and was told she had gallstones and inflamed gallbladder. What should she do to avoid gallbladder removal? She needs to get with a good functional doctor to guide her. I mean, that's a big question. Most people don't need their gallbladder removed, but you got to figure out why she's not forming healthy bile. I mean, generally when people have gallstones, taurine deficiency, vitamin C deficiency can be two of the more common reasons why that can be the case. And so those maybe are places, Diana, for her to start. I drove to Italy. No, I didn't drive. Oh, I wouldn't make. Yeah, I don't think you can. Now, I went to. It was a good trip. One of the, it's interesting. One of the things, because I went on this trip, wanted to see my father. He's 84, and he's a PhD physics doc, and he's still doing research. I mean, he's an animal, still crushing it and writing papers and doing research on advanced waves and what are called soliton waves. And anyway, he broke his hip, and so I wanted to go visit him because, at that age and with hip breaks, there's just always, the unknown for the future. So at any rate, it was a great trip. It was a great meeting. I got to hang out and spend some good time, good quality time. And then I got to observe just things about Italy that, because I've been to Italy several times. My dad's lived there for over 40 years. So I visited multiple times, but as a grown adult doctor with lots of experience, I observed Italy in a pretty different way this time around. And one of the things that, this is a big thing that's happening right now online, is there are people saying, yeah, I buy my grains from Italy. And so they don't grow them with glyphosate. And here's what I found. I found that the Italians are just as unhealthy eating all that pasta. As a matter of fact, more celiacs in Italy probably than anywhere else, but that's another story. But I found that even though maybe they don't have the glyphosate with their grain, there's still a tremendous amount of processed food in Italy. And they eat a tremendous amount of sugar. I think sugar is probably one of the bigger banes there. It's just like sugar in everything. So it was probably one of the biggest navigational challenges that I had while I was there, was just navigating around all the sugar in absolutely everything. But my dad's, for those of you asking, my dad's doing fantastically well. He fractured his hip and he's already up and, while using a cane to walk around and climb the stairs and everything else. So he's doing fantastically well. Let's see here. Can you do a class on fillers and food ingredients? Yeah, we could consider that down the road. We have one we teach one in our office for our patients that come through. We have a class on that already. Zinc helped me greatly, but I'm sensitive for copper overloading due to porphyria. Is it bad to take zinc without copper in my case? No, not necessarily. I would just say monitor your levels if you're going to take it for long periods of time. And that, I would tell you, any of you, the same thing, no matter what vitamin you were taking. If you're taking high doses of a vitamin and mineral for any great length of time, my advice is always going to be have that stuff monitored periodically, because every human body is a distinct, unique biochemical factory, and we're all going to have our own unique responses, reactions. And so, that being the case, most research studies that draw correlation, is just that, it's correlation. It's like in the general public, we see certain patterns, but it doesn't necessarily mean that pattern is going to fit you. And so test, don't guess. How to recover from biofilms. I mean, if you're trying to break biofilm down, one of the best substances to use is proteolytic enzyme combined with EDTA. You know, depends on where the biofilm is. If it's in your gut or nose, you can get compounded sprays for that kind of stuff. And you can also take oral EDTA and oral proteolytics. What's the best time to eat for thyroid patients? It's not a best time. It's not a best time to eat for anyone. It's a unique question. The best time to eat is when your body needs nourishment. Listen, and a big part of it is just listening to your body and listening less to people who are, or the marketing folks who are always trying to sell you more and more stuff. How far apart should zinc and copper supplementation be? I mean, you can take them together. They're in your food together. This is another area where people overthink it. You can take zinc and copper a couple hours apart, and that would be just fine. But when you eat food, when you eat organ meat, when you eat regular animal meat, when you eat certain nuts or seeds, guess what? That zinc and copper are in both, or in both of them are in all of those foods together. And so does that mean that one is going to override the other? No. So don't have a fear of taking them together either. Your body can handle them together. Now, if you have a severe zinc deficiency and you're really trying to dial it in, then that's a little different. You're going to go higher doses of zinc, maybe no copper, not no copper in your diet, but no copper maybe in your supplementation for a time. But as a general rule of thumb, you don't have to worry about that timing. I see so many people get hung up on that timing. And usually, in my experience anyway, the people that are pushing that, don't take this with that and don't take this at that time or that time, are people who are non-clinical. They're people that read a textbook or that read a study once, and they're imparting textbook information with a lack of wisdom and a lack of experience. It's a shame. You know, those types of people who lack the experience shouldn't be putting themselves as experts of the experience of those things. What can I do to help my muscle spasm in my lower back? Ice or heat don't help me. Why do you have muscle spasm? Because it just goes back to, I mean, there are things you can take that are going to give you some potential temporary relief. We have something called Ultra Calm and Ultra Sleep that have different herbals and nutrients that actually act as muscle relaxants naturally. Calcium and magnesium combined at higher doses can help with muscle spasm. Potassium can help with muscle spasm, but it just depends, Deborah, on why you have the spasm. If the spasm is because you've had an injury, then yeah, I would do like valerian and chamomile and theanine and GABA as a combination to kind of calm it down so that you can get some rest and some peace. You know, that's trauma, right? You're just trying to symptomatically reduce the symptoms so that you can relax. But if you just have chronic back spasms and you don't know why, and it's just something you're plagued with and there's not been any trauma, you need to figure that piece out. And there are a lot of reasons that can happen. I would say if it's in your back, probably one of the best types of doctors to visit is a good chiropractor. Should you take mercury amalgams out of your mouth or not disturb it? Both. So mercury, there's a reason why silver amalgams were used for so many years by dentists, is that they're extremely stable and they bond to the tooth really well and create a great seal, better than the composite amalgams. And so, do you disturb that filling that's in there that's tightly sealed? Not probably a major issue in your health. It's a question that, in my opinion, the way I answer that question for people that come to see me is we do what's called pre and post provocation testing to see whether or not there's a mercury issue for that patient. If there is, then my advice is get the tooth amalgam removed and get it replaced by an amalgam. But if that's not the case, then we leave it alone, generally speaking. Now I know there's a lot of people that would disagree with that, but I've also seen people have improper removal of mercury fillings get mercury toxic and have tremendous struggle. So it's the old saying, if it's not broke, don't fix it, but also test to discern whether or not you're building up a level of mercury in you that could become poisonous. Can bioidentical hormones like estrogen, progesterone, testosterone for women help support the thyroid? I mean, it can, but ultimately you have to, why are you supporting the thyroid with biological hormones? I mean, why can't you make your own hormones? This is the conundrum that so many people get into, is they try to take the hormone. Your body makes hormones. As a matter of fact, one of the key nutrients involved in hormone production in your body is zinc. So zinc deficiency can cause hormone abnormalities. And so if you're taking the hormone but not assessing or addressing the zinc, it's the wrong move, in my opinion. Is there that many questions left, Mel? What time is it? You guys are going to push me long today. Already have. What's the most common deficiency you see in people? Great question. So there's 5 that I see more common than any other 5, and that is, in no specific order, zinc, vitamin B12, iron, vitamin D, and omega-3, specifically EPA. So those are the top 5 I see. We see a lot in a lot of folks, but those are definitely the ones that show up more common than others. I have a friend who has major kidney issues. How does the kidney interact with the liver, and what starts a downward spiral for kidney function? A lot of things. It's not like a common, this is the answer to kidney dysfunction, although I will say I've seen a lot of stage 3, 4 kidney failure improve dramatically going grain-free, going on a no grain, no pain diet. I see it on a regular basis. So I would encourage your friend maybe to read and follow along with the diet. But really what affects the kidneys the most, if we want to point the blame on one big thing, it really is glucose, sugar, as a whole. And not to say that sugar or glucose is, let me reframe that. Natural sugar can be healthy in eating a piece of fruit. I'm not trying to demonize carbohydrate for you guys, but what happens in the US is 70+% of the diet in the US and in other countries like the US equals refined carbs. Basically sugar without nutrients. Carbohydrates without vitamins and minerals causes diabetes, very simply put. And so when you have increases in blood sugar, the areas that are affected the most is a process called glycation. Glycation is basically the sugar coats the carrier proteins and the other structures within your bloodstream and makes everything super sticky. And where this really starts to impact people first is in the areas where the blood vessels get small. And so that would be like the peripheral vasculature. This is why diabetics have peripheral neuropathy in their feet, because those very tiny blood vessels to the distal area regions are small. And so that sticky blood gets stuck. It doesn't move very well through there. And as that glycation occurs in those vessels, you get inflammation to the tissue. But the kidney the glomeruli in the kidney, which are the functional units of kidney cells, have an extremely small vasculature. So kidneys are affected tremendously. This is why so many diabetics end up on dialysis. Their kidneys start failing them. Now, part of the problem in modern diagnosis is that for a doctor to diagnose diabetes, there's criteria that they follow. And generally one of those criteria, one of the big criteria, and this is, maybe it's changed a little bit since I went through grad school, but not much, is that you have to have 3 consecutive increase elevations in blood glucose in your blood on your lab tests as you visit your doctor. Now they do this test called a hemoglobin A1C. And so generally speaking, if your hemoglobin A1C is like above 5.7, it's considered pre-diabetic. And then when you get like 6.5 or higher, it's really considered diabetes. So doctors now are really kind of using this test more and more and more to diagnose it. But the problem is, if you're already at 5.7 or 5.8, you're diabetic. What they're telling you is you're pre-diabetic. And what they're telling you at that point usually is, we can watch it and wait and go home and exercise and diet, which is not bad advice if the person goes home and does those things. But typically people neglect themselves in that frontier. And there's also there's also the advice that's been given, like when this doctor that says, hey, you're pre-diabetic, watch your diet and exercise, they don't really sit down and tell them how to exercise, and they don't really tell them what kind of diet to follow. They just say, watch your diet and exercise. And if they go to a registered dietitian, no offense to any of you who are registered dietitians, there's some brilliant registered dietitians in the world. One of my mentors in graduate school was a dietitian. But that being said, the vast majority of the ones that I've experienced professionally aren't very smart. And it's not that they're not smart, it's just that how they're trained. The way they're trained in this world of carb-rich diets, good, animal protein, bad, saturated fat, bad, seed oils, good. And so the advice they give these pre-diabetics just makes them worse. The dietary advice just continues to perpetuate the problem because they put them on high carbohydrate diets when it's the high carbohydrate diet that's creating the problem in the first place. And so that pre-diabetes, this is already pre-diabetes. This technically, if you're pre-diabetic at this range, you're really already diabetic, in my opinion. And you've probably been diabetic for at least 10 years. And so what's been happening for the last 10 years is your kidneys have been basically being hammered by extra sticky blood. And so they're just deteriorating at a faster pace. And so they're aging. And so by the time you're actually diabetic, based on the definition of your hemoglobin A1C being high enough or your 3 consecutive elevations in blood glucose, you've got 30 or 40 years of damage, of glycative damage to your small blood vessels in your kidney, and that has to be cleaned up. And so this is why a lot of people get kidney failure, even in the absence of a diagnosis of diabetes. Maybe they're pre-diabetic, or maybe they're not technically diabetic yet. I don't know if I answered your question, but that's a big one. And so changing the diet first, looking at this is why no grain, no pain is not. It's not that it's a keto diet or a low carb diet, but it balances out the diet in such a way where you're not getting this excessive blood sugar spiking from eating certain types of foods. And so when you bring that sugar down and you bring nutrients in, and those nutrients responsible for processing and getting rid of this, then you can heal and you can repair. And so start there. And then beyond that, really work with somebody. She needs to work with somebody. How long would choline stores last? It depends on the person's need. Choline's, one of its major roles is in stress modification and modulation through the chemical acetylcholine. So if a person's under tremendous stress, they're going to burn through choline a lot more quickly. If a person's eating a diet that's conducive to fatty liver, they're going to burn through choline a lot more quickly. So there's not a magic number. Curious if you have any experience using zinc carnosine for leaky gut, autoimmunity. Yeah, plenty of experience. I'm on T3, T4 compound for Hashimoto's. My thyroid peroxidase antibodies were 1200, normal range 60. I've been gluten and dairy free for 15 years. What other supplements or food tests be beneficial? So if you're not, are you grain free? Would be one of your gluten and dairy free, but are you grain free, Heather? No grain, no pain. Start there. If that doesn't work, come back and ask me the next level of questions, because there's a lot of things that can elevate thyroid antibodies. But if you're not grain free yet, that's going to be a big thing. That's going to be a big needle mover for you. Is 5.6 pre-diabetic? My functional doc said I am. I don't know what that means with that number. 5.6 technically depends on the lab, but most labs are 5.7 is where prediabetes starts if you're talking about a hemoglobin A1C test. Let's see, HLA-DQ1 with recurring uveitis. Any advice? No, I don't know if this is the same person asking a different question because we went blank earlier, but for uveitis, positive HLA-DQ1, you need to be grain-free, Rachel. And start there. That's really the best place to start. Go read No Grain, No Pain and start there. I've been told to take glutathione before getting into the sauna to help with detox. Do you agree with this? Depends on the person. Some people tolerate glutathione, some people don't. But it can be helpful pre-sauna. I hate to hear that. Joanne says, I'm usually careful about eating things people say are gluten-free, but I took a chance and I ended up with a TIA the next day. I investigated it and it was packaged mix that contained corn and possibly, I don't know what that last word is. Looks like erythritol maybe. Yeah, you know, we have a saying. This is extra especially true, and it sucks for social implications. And I know a lot of you thrive in social environments, and so it's maybe sad for me to say this, for you to hear me say this, because you like to be social. But when other people aren't on your diet and haven't read my book and aren't following along, or maybe they're not on that same page, and you're going to their house and they're like, hey, I heard you were gluten-free and I'm going to take care of you. We call that OPF, other people's food. And you know, usually I say danger, right? Danger for OPF, because most people haven't gone through the learning curve required to understand what gluten is. And so they're going to feed you some kind of processed garbage food that contains corn or rice or other ingredients or fillers that aren't good for you. And then you end up regretting the fact that you caved. But a lot of what happens to a lot of people is they don't want to offend the person. And so I get it. You don't want to offend, you know, your family member who's going out of their way to try to make something that, you know, that can accommodate you and your special diet. But they don't get it. And so the best way to kind of navigate that type of situation and not end up with a TIA is before you go visit with anybody, before you call ahead, let them know that you have special dietary requirements and that there's really no way that they can navigate those requirements for you. It's, you know, it's too much, and you would never expect them to have to learn all the things that you've had to learn in order to have an appropriate diet. And bring your own food, but let them know ahead of time so they don't go out of their way making something for you that then they get their feelings hurt when you don't eat it. So have that preemptive conversation. I always like to put words in the person's mouth. I always tell them, I know you love me and I know you care about me and you care that I'm my healthiest and my best. And so because I know you feel that way, I appreciate you understanding that I'm going to eat food that I bring, but I'm not going to eat those things that you're making, not because I don't love your cooking and love your food, but because I have a serious health issue that I need to make sure I can navigate safely. And if you put it that way, most people are not going to argue with you. And if they do, you probably don't want to go visit them anyway. Anyhow. Am I getting enough zinc in my diet from eating pasture eggs and regenerative beef ancestral blends? I'm grain-free and your book's advice. Probably, possibly, John. If you're in really good health, it's very possible you're getting plenty of zinc from your diet. It's possible for sure. But to answer the question definitively, it goes back to testing and not guessing. My advice is always that. Now, if you're not struggling in your health and you're doing really well and you're eating really well and you're doing what I call the 6 non-negotiable fundamentals of health, that's going to bed on time, exercise, clean food, clean air, clean water, and sunshine, and you feel fantastic, you know, then it's just a matter of choice. Do you want to, is doing lab testing something that you want to spend your hard-earned money on or not? And if it isn't, that's fine. Stay that course. But if you're struggling and you suspect you might have a zinc deficiency, that's where I encourage the testing. Let's see here. We'll take maybe 1 or 2 more, but we're 2 hours in. Let's go down a little bit. What's good for fatty liver? Diet change, first and foremost. Most people with fatty liver are eating excessive carbohydrates. And then probably 2 vitamins or nutrients that I wouldn't go without if I had a fatty liver. One would be choline, and the other one would be inositol. Those 2 B vitamin-like nutrients, when they're low, we know deficiency of choline and inositol can cause fatty liver. So those have causal relationship with fatty liver. So I would, if I were guessing, I would be on those 2 nutrients probably in higher quantities. Go back and watch my inositol and my choline crash courses to get more in-depth information about them. Okay, maybe one more. Scroll down. If you don't want, if you're trying to keep your skin moisturized and don't like products like lotions, what diet and supplements moisturize dry skin? Well, you got to make sure you're getting enough fat. And there's more than one kind of fat. There's saturated and unsaturated fat. There's polyunsaturated fat, and they're all important in the health of how your skin will shine and glow. So make sure you're getting plenty of omega-3. Make sure you're getting plenty of omega-9. And that would be things like avocado and olive oil for the omega-9 and fatty fish and fatty red meat that's been grass-fed, grass-finished for your omega-3s. Outside of that, I mean, there are a number of other nutrients that play a role in the moisturization of skin, but I would argue that vitamin A is critical, zinc is critical, vitamin E extremely critical. And so I'd probably start along that line, maybe even throw biotin into that mix as far as healthy glowing skin. Okay, I've got to go. I'm against a hard stop, folks. I appreciate you spending the afternoon with me. Thanks for your patience as I ventured out into the world and took a little time away. But I'm back now for really the rest of the year. So we'll be back on Tuesday with another brand new live, or not live, but a brand new crash course for you. And then Thursday again at 12:30 for a live Q&A. If you're new to the Dr. Osborne show, make sure you hit that bell and subscribe and bell button. That's how you get notified when we go live. But even probably better than that would be come visit me at glutenfreesociety.org, especially if you're struggling with autoimmune disease or you suspect gluten is playing a role in your health problems. If you sign up there for our free newsletter, I'll send you all kinds of fantastic free information about how you can navigate diet and lifestyle to help recover and overcome autoimmune disease. And while you're there, if you're in the market for supplements, we have over 100 different high quality, high caliber nutritional supplements for a variety of different ailments and reasons that are there and available to you. These are the same things we use in our clinic, and they're there for you, direct to you, without a doctor's prescription. So we encourage you to use those if you're trying to navigate the world of supplements and you're looking for high quality. And we appreciate your patronage because that's how we keep the lights on around here. We don't do sponsorships and we don't allow third parties to come in and influence people for money. So we appreciate your patronage in that way. And today, if you want to take advantage of our sale this weekend, we have a 20% off on our zinc product called Ultra Zinc. We can put a link into the feed if it's not already there. What's that promo code?
Z20.
Z20 is the promo code. So if you want to try out our zinc after talking about zinc today and Tuesday, save 20% and check it out and come back and leave a review and let us know how it worked for you. We thrive on your feedback. We want to do better as we grow, and we love hearing from you guys. So again, thanks so much for tuning in. I hope you all have a fantastic weekend, and we'll see you next